In this video, we will discuss about the systematic antitumor that is induced by CAR-macrophages. In the previous video, we have understood the antitumor efficacies of the CAR-macrophages. In this video, we will discuss about whether this CAR-macrophages can induce a systematic antitumor that can have elongating long-term antitumor response against the tumors. So for that, what they did is they took this B16F10 tumor mice model. So in this case, what they did is they inject the tumors at two different sides, left side and right side of the mice. So at day 0, they inject this B16F10 at the left side of the mice, and then they induce the secondary tumor or the distant tumor on the right hand side of the mice. And at day 8, they started treating the primary tumors using different lipid nanoparticles cases that is mentioned in the panel B, and thereafter they analyze both the tumors, that is primary tumors and the secondary tumors, on day 18. So what they are able to see is that in the case where they use CAR-PS-sLNP, that is their optimized model, shows not only the tumor suppressions in the primary tumor site, but it also shows significant tumor suppressions in the secondary tumor site. So first thing that come into the mind of the researchers is that this CAR-PS-sLNP might change the phenotype of the macrophages at the secondary tumor site. So they check the phenotype of the macrophages at the secondary tumor sites. So in this case, they do not see a significant changes in the macrophages phenotypes compared to the other lipid nanoparticles combinations. That is, the M1 macrophages increase remains non-significant, and this M2 macrophages decrease also remains non-significant compared to the case where they don't use the sting agonist. So this doesn't seems to be the probable reason for this significant suppressions of the secondary tumor or distance tumor. So what the next thing they did is they analyzed other immunological cells that are present near the distance tumor. So when they analyze the CD4 plus and CD8 plus T cells, they are able to see that those T cells are significantly increased in the case where they use CAR-PS-sLNP compared to the other control cases, both for the CD4 plus and CD8 plus, indicating that the primary antitumors response by CAR-macrophages triggers systematic antitumor response that leads to the activations of the T cells, and those activated T cells leads to the suppressions of the tumors at the distant site. So in order to validate their hypothesis, what they did is they check this affected T cells in the other parts of the body, that is in the spleen, and they are able to see that the affected T cells also significantly increase in the spleen in the case where they use CAR-PS-sLNP compared to the other cases. So this substantiates their hypothesis that this CAR-macrophages could induce long-term elongating immunological response that can have or that can take care of the tumors that relapse after a certain period of time, and this could be a positive thing for the CAR-macrophages, as patients does not need to undergo this CAR-macrophages therapy frequently, as the inductions of this CAR-macrophages once will lead to have a anti-tumor efficacies remain within the patients for a longer duration of time. Although these studies are done on the mice model, the results seems to be promising, as they can see the tumor suppressions for both the primary tumor sites and the secondary tumor sites, and the reasons they are also find out that it leads to the systematic antitumor, and which will cause the elongated immunological response or elongated memory immunological response against the relapse of the same tumors. So I hope you understood how they validate or how they check the systematic anti-tumors, whether such systematic anti-tumors are induced by CAR-macrophages or not. If you need to understand more about these experiments in detail, you can go through the reference that has been provided in the description. So that's all for this video. Thank you for your time.